So, getting my sister ready to go anywhere on an average day, actually, it is slightly different. It's an abbreviated version of what I would do when we have appointments, whether they be medical, going to church, or just going out to do something fun. She enjoys going out for a nice meal, so if that's the case, then I'll spend a little extra time with her. But to get her ready, I have to be certain that she's in a completely calm, not necessarily isolated, but just neutral environment. She may have had a bad day, but I know I need to get her out the door, but I can't bring that stress with me. So if I arrive and she's not ready, I'll calm her down, we'll sit for a few minutes, then from there I'll go ahead and get everything ready that I need. Getting ready for an appointment to actually leave the house, there are certain basic caregiving things that I think anybody would be concerned with. Oral care, hair grooming, facial grooming. And so what we would do is go ahead and pull out everything we need to be able to accomplish each of those tasks. Whether it be preparing an area with all of the implements out, putting a towel down because water's involved. So we'll go ahead and have a towel, have a washcloth, a damp washcloth, a very, very gentle soap. I prefer a pump, and I've already actually pumped it into the washcloth. I'll have a little bowl for being able to spit into the bowl, a cup of water, toothbrush, toothpaste, and then I'll lay everything out. And one of the most critical points is as I go ahead to start, I'll ask Maureen's permission, or I'll let her know in advance what I'm going to do. Because at this point, if she's calm enough, her eyes are closed. She isn't perceiving what I'm doing. She doesn't know that I've set everything up. So she's just sitting there with her eyes closed, and I said, "Sis, Maureen, I'm going to go ahead and start. I'm going to start with washing your face. Let me know if it's too cold or if it's too hot." Normally it's probably too cool because I've let the washcloth sit out. But she'll just calmly relax as I stroke her face. I avoid her eye area. I don't want any soap in her eyes. I'll use a clean washcloth just to gently swab her eyelids. And then I'll rinse out the washcloth and turn around and do a clean rinse of the face. And then I just let the air dry her skin. She's not one to use moisturizers and the rest, so I just let the air dry her skin. When it comes to brushing her teeth, that's a little bit more involved because I normally do also have a floss pick, and that's one thing really critical. I don't utilize straight floss to do her teeth. I get the small little toothpick style floss picks, and I'll let her know when I'll ask her to open her mouth, and then I'll insert it. Just let you know I'm going in between these teeth because some of her teeth are more crowded than others. And I said, maybe a struggle today, but we're going to get it in there because it's really her oral hygiene is incredibly important to her. So after I'm done with the flossing, we do the first rinse. Then I'll go ahead and prep her toothbrush. When I'll ask her to open her mouth. I'll let her know where I'm going with the toothbrush. "Sis, I'm going for your back molars. Could you open wider?" I'll do the bottoms first, slowly move from the back of the teeth to the front, doing the sides on the outside. Because she does have a level of dysphagia, and so she has tongue dysfunction, I'll let her know when I'm moving the toothbrush into the inside because her tongue tends to be in the way. But it also gives her a sensation of gagging if I don't instruct her to begin with. So I'll let her know the toothbrush is coming, and then very slowly I really take my time brushing the teeth. In between the lowers and the uppers, I always have her spit so that she doesn't have a lot of accumulation of the tooth foam, and then I move on to the uppers. Once I've done that, then the tray is back. I've got the little cup of water. She rinses, and it's very cute to watch her rinse because I have to instruct her. I said, "Sis, here's the water," because her eyes are still closed. She has no idea what I'm doing. So here's the water. Do you have some? And she'll nod that she has water in her mouth. And so she'll try to purse her lips. I say, swish, swish, swish. And so she's swishing, spit, and she spits. So it works out. It's really non-traumatic. It's not having someone ram a toothbrush in your mouth. And we have fun with it as best we can.